The situation with North Texas Medical Center was they built a new hospital. The hospital district built a new hospital in 2004. It's still in good shape, good appearance, but just due to, I think, some errors in management, possibly just things that occurred, they were headed toward bankruptcy quickly. CHC came in, did an assessment, an operations assessment, saw the potential there, so they were quick to recognize we can come in and help this hospital. And since then, we've really produced, and it's been a good time. One of the first things that CHC recognized that there were going to be substantial savings from were moving the hospital to CHC Supply Trust. It's a healthcare purchasing group that they participate in and kind of coordinate. So right off the bat, we were expecting 10% savings, but initially we even saw more than that. So huge increase to the bottom line just by the savings that we received from the CHC Supply Trust. I would say the next things that we saw changing were even some of our quality scores and HCAP scores. It sounds overly simple, but we needed to make sure that the community understood that we were there for them and we weren't going anywhere. So we rounded as a team from the C-suite down, and that definitely led to some better interactions with patients. They were open up and tell us what the problems were, if there were problems, and then we would address them. And so addressing their problems before they got out the door led to the better scores, both in patient satisfaction and quality. The first form of collaboration we had at North Texas was primarily with the corporate office at CHC. Immediately, I understood that Joe Thomason, our Senior VP of Operations for our area, he was very dedicated to ensuring that the hospital was going to be successful. He was there for every question that I had, and not just Joe, but the folks in quality and the folks on the clinical side. Legal, our lease was a very involved lease, and they were there. They were the best hospital legal team I've ever worked with, and I've worked with a lot of legal teams in the healthcare industry. One of the things that we've been really proud about is the reclaiming of the community's trust. And one of the ways that's been evident is through our Google review ratings. When we got there, our Google review rating was a 2.7, and lowest in the area, not good. And now it is up to a 4.6 in just 4 years. So we've definitely reclaimed the trust of the community. Having the physician coordination with our goals was huge. So we restructured a lot of our contracts too, especially our hospitalist and ED contracts, to have a customer service and a patient satisfaction component of their payment. So it was a huge eye-opener for them, I think, and it also produced a much better result in the emergency room and our hospitalists. I know the struggle for a lot of Soul Community hospitals that don't have a connection with a corporate entity for help, for guidance. They struggle with that mindset that they really want to stay independent, which is great, and I understand that, but sometimes you just really need that guidance. If you're struggling, I would say though, don't wait till it's too late.